Hello, and good evening, everyone. My name's Hayley. Nice to meet you. I'm one of the Lynton team members, and I'm just going to check everything's working fine, and then very quickly I'll be handing over to the lovely Sam and Rhiannon, who are going to be taking you through the webinar this evening. We've got a really busy webinar tonight. We've had so many people that have registered, so yeah, we're looking forward to it. I don't know if I'm looking forward to it more than summer though, because here at the moment it feels like spring has sprung. I don't know how everyone else is feeling, but oh, the sun has been shining here today and it's been absolutely fabulous. Should be a fairly quick webinar today. Take us about 30 minutes or so to get through the content. And then, yeah, if you've got any questions at the end, then we're going to try and answer as many questions as possible. Hello. Right. Okay. Looks like everything is working all fine for people. So that's lovely. Oh, and I can see lots of Lynton customers. So yeah, brilliant. And some new people as well. Oh, wow. Fabulous. Good. All right. Good stuff. So I'm going to hand over very quickly to Sam and Rhi, but my role at Lynton is in the sales team. So I can't possibly have so many people on a webinar this evening and not do a little push of one of our devices. So if you haven't yet, do please head over to the Lynton website and check out our device, the Focus Jewel. The Focus Jewel is for everything to do with lifting, firming and tightening. And we've got clinics out there who are getting amazing results with it. So if you're in the market at the moment for anything to do with lifting, firming or tightening the skin, then head over to the website and check it out. It's radio frequency microneedling and it's also HIFU. So that's my little bit done for this evening. Without further ado, I'll hand over. But before I do, I'll just do a very quick congratulations to Sam and Rhiannon. So Sam is our clinical director here at Lynton and Rhiannon is our training manager. And we have just recently won the Aesthetic Award for the Best Supplier Training Provider of the Year. So well done, guys. Amazing.
Thank you. We're too modest to say it ourselves.
Fantastic job. I know that you put so much care and effort into the update training that we do, the courses that we deliver, and the supplier the customer training that we do. And of course, these webinars, which are free of charge for anyone to attend. So thank you for that. And yeah, well done.
Thank you very much. Thank you very much. Thank you.
I'll hand over then.
Thanks, Hayley.
Super. All right, then we'll get started on a bit about carbon facials. So does anyone here do carbon facials? Let us know in the Q&A if you do, because I think it's one of those treatments. You may have seen it on oh, there we go. You may have seen it on Instagram or TikTok. It's just all over social media, because let's face it, some of the treatments that we do are a bit boring to watch.
Yes, definitely.
You can't say that about this treatment, because you get just blasting off the pigment is fabulous. You can hear it. It makes that clicking noise when you do the treatment as well. So it's a really Instagram friendly treatment, isn't it? And
it doesn't hurt, which isn't like a lot of treatments that we do.
It's
actually quite a nice,
it's so nice to do a treatment and not hurt people, isn't it?
Yeah. So, yeah, definitely.
And as well, it's one of those treatments where there's very little risk and there's very little downtime with it as well. Yeah. So you can have it, just before a big event. So this is why we have people like Kim Kardashian and Brad Pitt's exes, all of them seeing this treatment. So yeah, it's good enough for them. It's good enough for us, I think. So
yeah, definitely.
I'll tell you a bit then about what this treatment is. So it's basically, you need to use a carbon solution that we put on the face. So many years ago, when people were first looking at hair removal treatments, we know that people use long pulse lasers to basically cause a heating effect in the hair follicle. But they were looking at whether you could do hair removal treatments with Q-switch lasers. Now, for those of you that have lasers, you may know that Q-switch lasers don't cause a photothermal effect. They cause something called a photomechanical effect in the skin. The idea was that if you put this solution onto the skin, it would go into the pores and it would enable you to do hair removal with a Q-switch laser. Now, it didn't really work. So you could get some temporary hair reduction. So sometimes they call it a laser shaving effect.
Yeah, I was just going to say, I've heard recently it seems to be a bit more popular, the laser shaving, but
so about 20 odd years ago, people were doing this, and then it kind of died a death. So it's interesting to hear that people are trying it again. But I think when they were doing that, they realized that there was some benefits to the skin in doing this. So that's kind of where it came from. You need to use a Q-switch laser to do this treatment. So a Q-switch laser is a laser with a very, very short pulse duration. So this is not the sort of laser that we're using for hair or for vessels. It's typically used for tattoo removal and for the treatment of pigment as well. So yeah, you've got these very short pulse durations that are about 1 million times faster than what you get with a long pulse Nd:YAG. So it's an Nd:YAG at 1064 nanometers. And for those of you that know your lasers, you'll know that that wavelength, there's very little interaction with melanin. So it's the safest laser for the treatment of darker skin types. So another great thing about this treatment is that we can do it on all skin types. So perfect. It's not just Kim Kardashian that thinks it's good. There is some medical evidence. There's quite a few nice papers looking at this as well. So this one's quite a recent one with the DECA equipment, actually, that's looking at a few different things, but some really nice results on acne, on active acne lesions, which is nice. I'll show you some before and afters on that. There's another study here from a few years back from a US and a Korean study. And what's nice about this is that they were trying to do a comparative study. So they did a split face treatment. So they treated 25 patients. They just put the carbon solution on one side of the face. And then they did some quite interesting measurements afterwards where they actually were able to measure the pore size by magnifying the images. And they also used some equipment to determine how much sebum was in the skin. And what they found is they got nice results on both sides. So just doing the laser treatment gave some nice results, but it was enhanced by using the carbon peel. So you can see that 3 weeks after treatment, the pore sizes have shown a really nice reduction. So method 1 is with the carbon, method 2 is without. Really nice improvement. It did go back up after 12 weeks, so it wasn't completely sustained at that level, but still not up to where it was, you know, beforehand. And then look at the sebum
so it
result.
actually continues to get better.
Exactly. So after 12 weeks, it's continuing to get better. So this seems to be why we're seeing a nice improvement on acne with it. In terms of maintenance treatments, you can have this treatment as often as you want, really. You know, so if after 12 weeks, you're sort of thinking, oh, actually, I can see my pores are becoming a bit more visible, you can just come back in and have a top-up treatment. So it's nice to be able to offer those regular treatments, isn't it, and get that repeat. The thing with tattoo removal, you see your clients, you do 8, 10 treatments, whatever it is, and then that tattoo is not coming back unless they get another another one that they don't like. But, you know, so it's nice to be able to do these treatments where you get some regular kind of income from them as well. So who's it for? Right. Suitable for all skin types, as we've said. People who have oily skin, excessive sebum, acne prone skin, really nice for that. Enlarged pores, so that comes with
a big one.
It is, yeah. So certainly as we age, our pores get big, but it's not just older people, you know, young people as well, especially if they've got oily skin, they can see that. It's nice for improving pigment irregularities and dyschromia. So just, sun damaged skin. This is not going to get rid of wrinkles, really. It's not a wrinkle reduction treatment, but it can certainly soften fine lines. And it gives you, it's just like a little collagen boost, really. And I mentioned acne and post-acne erythema as well. So again, just improving the skin tone. And, you know, as I said before, you can have this treatment, you know, a few days before a big event, because you're not going to, very low risk, you're not going to be red.
Significantly low downtime.
Yeah. You did a treatment for me, didn't you, before the awards? So I've got a video of that, which I will show you in a little bit.
I know it's one of those that I've had it just in demos, in training sessions. So I'll actually demo it on one hand, and I always notice there is a difference in the hand that I have treated and the hand that's never had treatment before.
And that's like almost immediately after.
Immediately after, yeah, I mean, it doesn't look, it looks pretty similar now, but yeah, immediately after I can definitely see a difference in that my skin just looks a lot brighter, you know, fresher, slight plumping. So there is a tiny bit of swelling, but not in a bad way. So yeah, there is definitely an improvement, but it's something that very low down, low downtime.
Yeah,
nice treatment to have.
Yeah,
definitely.
Exactly. So the treatment protocol we'll go through, but I'll show you the video and we can talk through it. That might be an easier way to do it. But basically we cleanse the skin, apply the paste onto the skin, and then there's this optional third step. Now there are some Q-switch systems that have something called free running mode, or sometimes it's called the thermal pulse.
Yeah. And
it's basically, it's not a Q-switch pulse, it's rather than a nanosecond pulse, it's a microsecond pulse. So it's much longer than a Q-switch, but it's much shorter than a long pulse laser. So it's somewhere in the middle. So we can do that. We can do a pass with that. Then we use the Q-switch. So you have to use the Q-switch then to remove the carbon facial. Then again, you can follow it up with an optional short pulse ND YAG, or if you don't have the short pulse. So for example, Rhi, you tried it the other day, didn't you, with a Lumina?
Yes, yep. So I used the Lumina system. So yeah, we did the Q switch to remove the carbon, and then you can use the long pulsed ND YAG for skin rejuvenation following, and that's a really nice combination. Yeah,
it just gives again that extra bit of heat in the dermis to stimulate, you know, the fibroblasts and
and again, still low level. You know, you're not expecting like a lot of redness with these treatments. You know, it's a nice, like we said before, comfortable treatment, which we're not used to delivering.
And settings, you can see the settings here, they're incredibly low.
So
really you know, you need to just find the setting. You don't need a thick layer of paste, a very thin and just use the lowest setting that removes the carbon, which is generally about 1 joule per centimetre squared.
And it's a really good point actually with the carbon paste. Do keep it really thin. You don't need loads of it because it just takes forever to get off otherwise, and it's not necessary. It takes a long time
to dry it, doesn't it? It's got to be dry when you do it. So this kind of just talks about this in a bit more detail. So you've got this optional first pass where you put the paste on and then you use the thermal pulse to kind of dry it. That helps to bind the paste onto the cornea sites. It gets into the pores and it sort of binds with the sebum as well. And you also get a little bit of, you know, sort of heat deposition within the dermis as well. Then this is the exciting step. This is where
this is the fun bit.
And it basically, what happens with Q-switch lasers is that you get very rapid heating, very rapid heating, but it's happening over such a tiny pulse duration, such a short duration in time, that the heat doesn't diffuse into the tissue, but it causes basically a photomechanical reaction and an explosion of the carbon. So the kinetic energy that you get from the carbon coming off your skin, that in itself transfers some causes, you know, very mild reversible damage to the stratum corneum and to the pore itself. And you get a kind of a micro ablative effect where it's taking off that dead skin. So it's kind of like an exfoliating, nice deep cleanse kind of thing.
Like microdermabrasion, but more fun.
Exactly.
More fun to do.
And then you've got this other option where you can use, so the final pulse, once you've removed all the carbon, a final pass with the thermal ND YAG, or if you don't have that thermal pulse, just with your standard long pulse ND YAG, nice low settings, you know, sort of just to do a bit of collagen stimulation. Let's see if this video will work. And you can talk us through really what you're up to here.
So essentially, obviously, this is when we did the treatment for Sam a few weeks ago. So we're just applying the carbon paste now. Like I say, it's a very thin layer that you need. You don't need a thick layer. Obviously, if you're doing a thick layer, it's going to take quite a while to dry. So you can just sort of be waiting around, waiting for it. So it is just a thin layer of the carbon paste. And like Sam mentioned, it's a case of as that carbon dries. So what we're doing at the moment is the thermal mode. It's that short pulse ND YAG and just passing over the area 2-3 times to help dry the carbon. And as the carbon is drying, it's grabbing onto the dead skin cells. It's grabbing onto the bits of skin that we don't really need on the surface. So that's essentially what we're doing at the moment. So during this step, Sam, I know it was a couple of weeks ago, but can you remember what it felt like?
Yeah, very, very comfortable. So you can feel very slight.
You feel something, can't you?
You can feel something, but it's not. It's just, it's nice. Yeah. You know that I'm a wimp, so
yeah.
you know. It's very nice. And here you can start to see now you're using the Q switch.
This is the fun bit. So now we've switched on to Q switch mode. So the system that we use is a nanosecond Q switch, but you can use picosecond if that's what you've got. They work in a very similar way. So essentially, as we're just using very low settings, so around 1 joule per centimetre squared. With your tattoo removal, the system that you've got, we tend to use a larger spot size, the largest spot size that you've got. We're using a repetition rate of 5 Hertz, so it is quite a quick treatment. And as we're passing over the carbon, it's, as Sam said, you can hear it clicking. I know you can't on this video, but you can hear that clicking, you can hear the snapping as it's lifting off that carbon and taking some of the dry, dead skin cells as it goes.
Yeah.
So once we've completed that Q switch, that's the step 2 of the carbon peel. Now we've switched back into free running mode, which we have on this system on the studio, where it's using that microsecond pulse. So this is where we're just passing over the area, 2 to 3 times again to stimulate that little bit more heating, stimulating them a little bit more collagen, and it is a nice finish to the treatment as well. Like we said, if you haven't got the microsecond pulse mode or the thermal mode on your system, you can use a long pulse ND YAG and use your skin rejuvenation settings. You don't need very high settings, but it's a case of, we'd advise just to make sure that all the carbon peel is off the skin, and you can just do a pass with your long pulse ND YAG just to stimulate that little bit more heat.
Yeah, that's a really good point, Rhi, that if you're using a long pulse ND YAG, you really need to make sure all that black peel has gone, because that's going to cause too much of a thermal effect, which you don't want. So
it's just a case of, you can use damp mitts, damp cotton pads. You don't need to be doing a full cleanse. That carbon does come off quite quickly. You just need to make sure that it is all off the skin if you're then using long pulsed ND YAG.
Seeing you use the mitts just reminded me that one of the things that if you can do at the start is, if you can, when you do your initial cleanse, before you put the peel on, if you use warm mitts, that helps to open the pores. That helps for the solution to get into the pores a bit more effectively. I'm just going to, before we move on, I'm just going to stop because I think we've got a few little questions.
Yeah, we have got a few questions. So a really good question. Do you keep the setting the same for every session? Yeah, there's no need on this one to be increasing your settings. All you're looking for, you just need to be using settings that's going to remove the carbon itself. So yeah, typically it's anywhere between 1 and 3 joules. Personally, I don't think I've ever had to go over 1 joule per centimetre squared with this treatment.
Well, it depends. It does depend on the carbon solution that you're using. Some are a bit
thicker,
aren't they? A bit more difficult to get rid of. So a few of you are saying that you do carbon peels. Good tips. In terms of results, right? I think it's really important with this. I mean, we'll talk about that. We've got a few slides in a second. We've got to be realistic about the kind of results we're going to achieve with this. This is not like a fractional treatment where there's very little downtime, and so you're not going to get, people are not going to look 10 years younger after it. But I'll show you some pictures. We've got some nice pictures and
really good photos,
the sorts of results that you can achieve. And these are just some not some with Lynton equipment, some with different equipment, but you know, just to give you an idea of the sorts of results that you can get. Can you treat males with acne and shave? Yeah, you don't have to worry about, it's not going to affect hair growth. You might get some temporary hair loss. I mean, that is a possibility with Q-switch lasers, but we don't see that very often. For example, when
we don't see it with tattoo removal.
Exactly, and we're using much higher settings, aren't we? Yeah. But, you know, if you were going to use the long pulse ND-YAG mode, then you may get some hair loss. Yeah. But not with the Q-switch.
Yeah. So just while we're on that, sorry, my cat's just joined me on my knee. Just while we're on that, you know, if you are treating a client, I'm going to say on the face, you know, if you've got any clients with tattoos in the area, semi-permanent makeup, you do need to stay away from it, because obviously it is a Q-switch laser and it will target the ink itself. So do just stay away from tattoos, semi-permanent makeup.
Yeah, Percy's asked a good question about, is there a difference between the different carbon creams? I think there probably is. I'll come on, I'll talk a little bit more about that in a bit. Does it bleach hair? If there is hair present, then sometimes you might, with a Q-switch laser, you can get some temporary whitening of the hair, but that will be temporary. Yeah,
usually on the next growth cycle it does come through repigmented.
Yeah. Kerry, can I try it with my melasma? Oh, it's $1 million question. It's that right. So there is some evidence that the low level Q-switch ND-YAG treatment can help with melasma, but as you know, melasma is such a difficult condition to treat. I think using this as a monotherapy is probably, you know, you're going to have to use it in combination with, well, definitely good sun protection, which of course you know, but also perhaps some pigment suppressants and stuff. So it certainly can help, but it's not a cure for melasma. Do you keep the settings the same? Yeah, I mean, if you wanted to do with the final pass, you know, if you wanted to increase that a little bit, you know, just to get a bit more collagen stimulation, then that would be fine. How would I know if I had a thermal mode on my device? You'll have an option and it will say something like free running mode or short pulse ND-YAG. I would imagine if you don't know if you've got one, you probably haven't. So oh, another question about melasma. Yeah, I would tend to contraindicate melasma if you cannot also manage it with other topicals and things like that. So, you know, I know that there are some sort of medic-led clinics that are using it in combination with, you know, hydroquinone and tranexamic acid and things like that. But if someone's, again, it really depends on, you know, doing a good consultation, because there is a risk of making it worse, as there is with any laser treatment, unfortunately. Is the plume messy? Neil, that is a brilliant question.
Yeah, it is a really good question.
Come on to that in a second. Okay, I'll carry on and then I'll come back and see if there's any questions that I haven't answered in a sec. Okay. Oh, I don't want to watch that again. There we go. Yeah.
Perfect timing.
Yeah. Yes, you do have to protect the lens, because the carbon, as it comes off, you can get deposits on the lens. So the way that we do that is it's very simple, just with a piece of cling film, and you can put that in between your spacer and the handpiece itself, as Ree's demonstrated there, and that protects your lens. So yeah, you can do that, and you should do that. There are some systems, so anyone who's got the Lumina AQS, there's a little cover slip, a protective cover slip in there. So it's probably not quite as crucial with some systems. And there are some other ones. So with our new Smart Pico, there's a dedicated carbon peel spacer that's got a very long spacer, so that you don't get any deposits on the lens.
If it did get on the lens though, would you be able to clean it?
Yes.
Sam, is there anything that you can clean it with?
Yeah, so optical grade methanol is ideal, but you know, yeah, something like that. Speak to your supplier. If it's us, our engineers can, you know, sort of recommend. But optical grade methanol is ideal, because you know that that's not going to damage any of the optical coatings on the lens. Yeah, it's generally a no downtime treatment. You would do a course, typically 4 to 6 treatments every 2 to 4 weeks, about every month or so. Combine it with good home care, and also it's an ideal treatment to combine with other aesthetic procedures. So you can do things like, I mean, Hayley mentioned HIFU earlier on, IPL treatments, not on the same, I wouldn't do those on the same day, but certainly, you know, alternate, if you're doing this every month, then every 2 weeks you can alternate it with other treatments.
So I know we've had a couple of questions about combining it with the Illumifacial. So that's your peel and IPL combined.
Yeah.
So yeah, you could do it, but like Sam said, you wouldn't do it on the same day. So we would be alternating. So you're potentially seeing your client approximately every 2 to 4 weeks.
Yeah.
But obviously you'd only treat them if their skin's recovered from that last treatment.
Yeah. Yeah. So clinical results then, it's going to microablate your stratum corneum, so you're going to get that instant kind of freshness to your skin. Certainly really nice results on visible pores. I'll show you some pictures.
Yeah, really good photos I've got.
Perhaps a bit of a tightening effect, maybe a bit of collagen stimulation, but you know, this is not a treatment for really lax skin, really aged skin either. You know, it's a collagen boost treatment really, rather than a kind of, you know, anti-wrinkle treatment. But certainly for acne, it's, you know, some really nice results.
Yeah.
So here is you know, here is a realistic result, a nice improvement, I think, in her skin tone. And to do this, you know, with a no downtime, no pain treatment as well, is great. Pores here, so I think you can see, especially here on the cheek there, if you compare that and that, so nice improvement. Perhaps some lightening of the pigment possibly as well, but what I would be doing is I'd just be using my standard Q switch or an IPL to, you know, to treat that pigment too. This is quite a nice one. This is, you know, on quite sort of older skin, definitely I think a bit of a softening.
Definitely.
You know, bit of improvement.
I mean, it doesn't look dramatically different, but you can definitely see an improvement after a low level treatment. Yeah, really nice improvement.
This is a nice one. This is one treatment.
This is one that every time I see these photographs, I'm thinking I really need to start getting these done myself more. It's been a while and my pores do my head in.
It's really common that, you know, people don't like the visible pores, and you know, they can be tricky to treat. There's another example. It's a 42-year-old.
Really nice results there.
This is nice.
This is amazing,
isn't it? And there's some evidence that the results are longer lasting on the nose as well than they are on the cheeks. So it looks almost like the little sort of filaments that you get, sebaceous filaments, have been removed. And you can see how if the ink is, the carbon paste is going into the pores and then being blasted off, how it can perhaps help with that as well. Acne treatments then, so this, you know, as we know, the carbon peel, as it's coming off, we're getting a kind of, it can help with plugged pores, it can reduce the amount of sebum. There's some sort of, again, I don't know if this has been tested, but it's been sort of suggested that there's actually a reduction in sort of the bacteria that's on the skin as well from the laser treatment. And it's not just limited to face, so you can do this off body. So for people who have acne on their back, for example, we can treat those areas as well. Some nice results here.
Yeah, so I know this photo, like that photo in particular, was a little bit blurry, but you can definitely see that improvement in the post acne erythema. Like really nice improvement. And
here there's still, you know, some residual post-inflammatory erythema, but there's no active pustules anymore, you know. So and this is, you know, after quite a few treatments, 7 treatments.
But again, 7 low-level treatments, like it's not an uncomfortable treatment, and it can be used anywhere on the body.
This is quite nice, you know, quite congested, kind of bumpy skin, and a nice improvement there as well after 5 treatments. So someone asked about the different carbon peels that you know that you can get them in various places, but Deca have now produced one specifically for use with laser. Let me show you it. So I'm going to put a tiny little blob on there. and you can see how it darkens as you rub it in, which I think is fab because it's kind of encapsulated carbon. So as you rub it in, it gets a bit darker. So that's quite a thin layer there. It's not really black, so it's easy to shift, which means you don't need very high settings, which means it's quite safe to use on all skin types, so we can use it even on the darkest skins. There's also some other nice active ingredients in there as well, so there's things like, oh god, I've messed up the bottle now. There's things hyaluronic acid, mannitol, which helps to reduce swelling, vitamin B3, so that can reduce inflammation and treat acne as well. So a few other nice little bits and pieces in there. So you might ask, where can you get this from? Well, you can get it from Lynton. Costs £32 plus VAT per bottle. There's a 10% reduction if you buy 3. It costs about 80 pence per treatment, something like that. So it's less than £1 per treatment. Yeah, a little bit goes a really long way. So
you've just seen there from when Sam just put it on the back of her hand, a tiny bit goes a really long way. And in the treatment video that we showed you earlier, we used the Deca Peel, and I probably didn't even use a full pump. It was probably about half a pump to treat Sam's full face.
Yeah, so we think you can get about 50 treatments thereabouts in the bottle. In terms of how much you're charging, I'd be interested to know, those of you that are doing offering it, how much are you charging? If you look online, you can see prices anywhere from about maybe 100 up to about 300, 350, even on Harley Street.
Yeah. So
the average price seems to be about 150 to 250 or thereabouts. And again, you know, you can add in that. So that video that we showed, that was speeded up ×7, and I think that was about 5 minutes. I think in total it probably took about 25 minutes to do.
Yeah, not even 25 minutes for us to do that.
Yeah, so of course you can do, you know, do a nice cleanse and things like that afterwards to sort of extend it if you want to. But yeah, so that's, you know, to do the treatment you need the peel, you also need a Q-switch laser. So if you need a Q-switch laser, I know someone that can help with that as well. So we've got a number of different systems at Lynton that we can use for this treatment. So the Luminet Q, the Lumina with the active Q switch on it as well, the Studio system and the Smart Pico. So all of those can be used. I think we've got time for a few questions.
Yeah.
So
we've got a nice range of prices. Amy, you mentioned about maybe increasing your prices. I would, definitely.
How much is Amy charging?
85.
Yeah, I think you can knock it up a little bit from that, definitely. It's just one of those treatments, people love it. They just, you know, if you put this on your social media channels, you'll have so many inquiries about it. Questions here on, it depends on location, a guide on pricing. So about 150 to 250. Do we do a qualification for this treatment? No, there aren't any qualifications for it, unfortunately. So no, not yet. Watch this space, I guess. We'll speak to BTCT about that and the awarding bodies. Yep, safe for all Fitzpatrick skin types. How about age spots? I think if you've just got a few age spots, I would just treat them with your standard Q switch alone, probably. You know, do that and then do your carbon peel treatments. Would you be able to paint white hair with carbon to aid hair loss? That's a good question. So people have tried to do this. There's a product on the, well, I don't know if it's still on the market. I haven't heard of it for ages. It's called Melodyne, or it's sometimes called Lipoxone, and that is a carbon-based solution. It's a squid ink derivative. You spray it onto the skin, and it kind of is meant to get sucked up by the pores, and then you can treat grey hair and blonde hair and stuff.
Yeah.
I don't know.
I've just been talking about this today in the level 4. Maybe. And the application regime of Melodyne is ridiculous. So it takes 3 hours in the morning, 3 hours at night.
3? No, 1.
Yeah. No, so it's from my understanding, it's 6 coats, and you have to leave 30 minutes between each coat, and you've got to apply that twice a day.
Oh, well, I've got a free 6 hours in the day to do that. So
Yeah.
I think it. I mean, I did know a customer once who she treated a lot of transgender clients who are utterly dedicated to getting rid of their hair, and she did find it useful because she said that that application regime, if you stick to it, you know, it can help. But anyway, sorry, that's
sorry, we're diverting.
But yeah, I don't think this this carbon pit, you know, I think people were trying that originally, but the results aren't really great for it. So freckles, again, I would just be using my standard Q switch. I think that you can get some improvement definitely with skin tone, but you're going to get the quickest results if you just do a standard pigmentation treatment with your Q switch laser. Do you have to be careful with darker skin type? There's always an increased risk of post-inflammatory hyperpigmentation when we're treating darker skins. So but this is a very low risk treatment, and in the studies that I've seen, it's kind of invented in East Asia, really, in Korea and Japan, and very low risk of post-inflammatory hyperpigmentation. I would always be saying that it's possible, but yeah, I think it's going to be lower risk than a lot of the treatments that we do. Can the fractional CO2 smart side laser settings be modified to provide the cool peel? So the cool peel is something different. The cool peel is a CO2 laser treatment, which you wouldn't combine with the carbon solution. So for that, you do need a Q switch ND YAG at 1064. I don't know whether you can do, I haven't seen any papers where people are doing these with other Q switch lasers like a Ruby or an Alex, but obviously those shorter wavelengths are not going to be as safe on darker skin types. So I think really you do need a 1064 nanometer Q switch to do this. Kirsten, I wouldn't treat a pregnant lady myself for obvious reasons. Would it be okay to do a treatment myself? I cannot say that would be okay for you to do, but I treated myself while I treated myself when I was pregnant. Yeah, I wouldn't do it on anyone, but, you know, for the reasons that you're talking about, you know, just sort of medical legal reasons. Potentially there's increased risk of pigmentation change when you're pregnant, but for a low level treatment like this, I think it would be fine. Could we use it on the legs? That's a great question, Sophia. I don't see why not. I don't see why not. You can certainly, as I say, use it on the back. I was wondering whether it would be useful for things like keratosis pilaris. That would be a nice thing to try. You know, that's you can get on the back of the arms. I haven't seen any studies on that. I've never tried it. It's just, you know, just possibly. So yeah, you know, I would certainly give it a go. I'd love to know if it works well for that. Oh, follicular keratosis, there you go, we've got the same. Could it be done on the buttocks? Absolutely. Why not? And is it available on the customer portal? Yes, it is, as of today, so you should be able to get it from the customer portal. Becky, charging £99 in Bromley. And Amy, increase it. Sorry, I'm a bit behind where we was. Sorry. No, it's all right. £70 per session. I you know, you've got to look at what other people, you know, what your competition is, where you are. All of those things will come into play, won't they? So and the thing is that, you know, it's once you have a Q switch laser, obviously that's a big initial outlay, but once you have a Q switch laser, it's very low, sort of, you know, very low consumable costs on this. So if you're only going to be able to get 100 quid, whatever, then fine. Kerry wants to know about the Pico. I will tell you all about the Pico, Kerry, definitely some other time. Perhaps we'll do a webinar on that soon at some point as well. We'll talk about it at the BMLA conference. Everyone come to it. Yes, do. If anyone it's in Cardiff, 10th, 11th and 12th of May. Yes, good plug, Ree. Kerry will be happy. Can we use it with the Motus AY? Unfortunately not. No, you do. That's a long pulse ND YAG laser, so you do need a Q switch to do that. Can it make DPN lighter? There are protocols for treating DPN with Q switch lasers. So again, I probably wouldn't do it with this. I'd use my Q switch laser. My choice for DPN is generally CO2, but that's because we're lucky enough to have lots of different ones in our clinic. Amy, you sent an order in today. You want to add the DECA peel. If you just drop an email to info@lynton.co.uk, then that will go to Kay, who deals with our skincare, and she'll be able to do that for you. Luminet Q, yep, you can do it with the Luminet Q. You did a treatment with the Luminet Q not that long ago, didn't you?
I did, yeah.
Yep. Yeah, no option with the Motus AY, I'm afraid.
Oh, naughty child, Kim. I get
Oh.
it. Don't worry, it's all recorded. It'll be going on our YouTube channel.
Yeah, yes. Would you make the carbon peel for ND-YAG or IPL? No, unfortunately, it's too dark. So if you use a long pulse ND-YAG or an IPL, it would be like treating over a tattoo or a dark skin type with an IPL. You just get too much heat, and you get too pronounced the thermal effect. You get blistering and stuff. So unfortunately, you need that Q switch laser. You need a photomechanical effect. Kerry says she treated you when you were pregnant.
We didn't know I was pregnant then, though, Kerry. I think I was like 2 weeks pregnant then.
I've got a Lumina, is the Q switch an additional handpiece? Yeah, you can get an additional upgrade on the Lumina. So on the Lumina, it's the active Q switch with the arm. But if you want a price for that, Sophia, then just drop us an email. We'll get someone in the sales team to contact you about it. Yes, Elaine, I can send you a copy of the presentation. That's fine, and it should be on YouTube, so you can look over it again if you've had children or cats distracting you or whatever. But yeah, I think that's it. I think we're done, so we'll leave it at that, and you can enjoy the last bit of the bright evening that we have. Yeah, fabulous.
Before it starts raining.
Yeah. Thanks everyone for your attention.
Thank you.
Great questions, and we'll see you again for another webinar soon. All right, take care.
Bye.